Welcome back to The Lead, the politics lead now. Fratricide, brother killing brother. That's how Louisiana Governor Bobby Jindal sees the infighting that has seized Republicans in Washington. I recently spoke with the chairman of the Republican Governors Association about the shutdown, the party, and what Obamacare means for his state. So, Governor, you said last year that Republicans have to, quote, stop being the stupid party. Do you think this strategy on the shutdown, tying defunding of Obamacare to the shutdown, or to government spending causing the shutdown, do you think that's smart?
Well, look, a couple of things. I don't want to engage in Republican fratricide. There are more than enough Republicans fighting each other, going after each other. I do think that it makes sense to fight to repeal and replace Obamacare. I think it's bad policy. Forget the politics. But we're also, I'm the chairman of the Republican Governors Association. We're launching an initiative called the American Comeback Story. We think voters are rightfully just disgusted with all of the dysfunction in Washington, D.C. Right now, it's the spending, it's the CR crisis. A couple of weeks from now, it'll be the debt ceiling crisis. There'll be another fiscal crisis. Nobody's talking about the root cause problems. Nobody's talking about it's the debt, not the debt ceiling. Nobody's talking about the spending. Nobody's talking about the existing entitlement programs. So what we're saying is governors are actually proving with results that conservative policies work. On the ground, we're doing education reform. On the ground, we're doing pension reform. On the ground, we're creating private sector jobs. On the ground, we're cutting government spending. We want to take back the Republican brand from D.C. For too long, we've outsourced it to Washington. We've got 30 Republican governors doing a great job across the state capitals across the country. The important discussions aren't happening in D.C. I would say the president hasn't shown real leadership. Where's the debate about the changes we all know need to happen in the entitlement programs? Where's the debate about he hasn't even projected yet one budget where we stop spending more than we take in the short term, the medium term, the long term? This isn't sustainable. All they do in D.C., it seems, is fight about the symptoms, not the root causes. Today, it's the fiscal debate. Tomorrow will be the fiscal cliff, the debt cliff. Who knows? There'll be another crisis tomorrow.
Governor, let's talk about health care for a second. About 20% of your state does not have health insurance. What's the solution there, and why wouldn't you take Obamacare money to expand Medicaid to provide insurance for them?
Well, look, in our state, 3.5% of our children are uninsured. We have a 96.5% insured rate for our children through public and private programs. We're the only state in the country that's operated a unique system of hospitals, 10 hospitals. We've transformed those through public-private partnerships to provide a better safety net. I think the president was right. There are real problems in health care. I think if you've got a pre-existing condition, if you're trying to buy an individual policy outside the group market, it can be too expensive, may not be available to you. I think the wrong thing to do is to expand the government's role. In my own state, for example, for every uninsured person that would have been covered by a Medicaid expansion, more than one person who would have otherwise had private insurance would then be kicked out or lose that private insurance, instead go into a government-run program. That makes no sense.
But still, 20% of your state doesn't have insurance. That means costs are passed on to people in your state like you who do have insurance. Those individuals will be less healthy because they don't have primary care physicians. They will use emergency rooms as if they are their doctor. Those costs are being paid by Louisianans.
Well, again, we do something different from any other state. We're the only state in the country that's got these state-operated hospitals. We have 10 of them. Now we're in the process of transitioning those to public-private partnerships that provide a safety net. We also subsidize outpatient clinics. There are innovative public-private partnerships, conservative solutions we're applying that don't involve the government taking over health care, don't involve a one-size-fits-all approach from D.C., and that's the point. I think governors would have loved to have come to the table and said, look, there's a lot of money wasted in Medicaid and DISH, which is another state-federal program today.
Right.
We spend over $1 billion in Louisiana on our uninsured. There are better ways to spend those dollars than what we're doing today.
Lastly, sir, before you go, it's no secret that your name is being bandied about as a possible 2016 candidate. When are you going to make a decision, and what are you looking at to figure out if you run?
Look, the honest answer is I don't know what I'm going to do in 2016. I'm the head of the RGA. We're focused on 38 governor's races between now and the end of 2014.
I believe you that you don't know, but I also believe that you're looking at it and that you're trying to figure out if it makes sense.
Well, and I also, look, I've got a responsibility. We're continuing our reforms in Louisiana. For me, as I think about that, it would have to be, do I think I can make a difference? Do I think that I've got something to offer that's not there? Do I think that there's a way that I could help improve and help lead the country, and that's not being offered by a candidate that's in the race? I do think the next president, I do believe, should come from the ranks of the governors. I do think that governors, unlike the folks in D.C., are actually implementing solutions. I think that one of the criticisms we've had about this president is that President Obama had to have on-the-job training, never had run anything before he was elected president of the United States. We can't afford another 4 years of that. So for a Democrat or Republican, I would hope that our nominees would be governors.
A governor. All right. Louisiana Governor Bobby Jindal, thanks so much for stopping by. We appreciate it.
Thank you, Jake. Thanks for having me.
Let's check in now on our political panel there in the green room. Dana Bash, a parenting question for you. If you took your son to the playground this weekend and it was chained off because of the shutdown, would you let your child sneak in anyway, like this young patriot recently did in D.C.'s Capitol Hill neighborhood? You see her act of civil disobedience.
I don't know. I don't know if I would. I think it would be sort of a game day decision. I don't think I would, though. But I will say that I did take my 2-year-old to the park, a D.C. park, this Saturday, and it was open. So I didn't have to make that decision.
All I know is every time we drive by the zoo, my daughter boos Congress. Boo. Do all the closures pegged to the government shutdown really make sense? Stay with us for more of The Lead.